So now that I'm at a somewhat okay, slightly all right mental space, I figure I finally do my fertility update. So here we go. If I cry, I'm not re recording. Just know that once I wipe the tears, I'm still a G. So we went through our last and third, well, most recent fertility IVF cycle was our third. This past cycle, out of the entire year of doing cycles, I will honestly say this cycle was hands down the best cycle. Hands down. Every single monitoring appointment was stellar. I mean, it was great. My follicles was good. My estrogen levels was awesome. Progesterone was good. I mean, this cycle, hands down, can go in the record books for being my best cycle to date. Retrieval, we retrieved 12 eggs. 6 didn't fertilize. They called and said 6 fertilized. We were freezing this month, so we like, yeah, we got 6, yeah. Every day they called us, they kept giving us a awesome report. Yeah. So fast forward, it's now time for transfer. They did do ICSI. They said out of the 6 that did fertilize, 2 was ready to go. The remaining 4 look awesome. Everything looks great. Yeah, but 2 was ready to go. We had 2 that was, one that was grade A, the highest grade you could get. We had another one that was a really good grade. Transfer day call. My doctor called that morning to see if we wanted to transfer 1 or 2. We decided on transferring 2 because they were the highest grade. So we just figured that out of the 2, 1 would at least, stick, or both would stick. And besides, we said, well, we have 4 and we were just told they are definitely going in the freezer. That's the exact words we were told. Transfer day come. Transfer was freaking awesome. My favorite transfer doctor, Dr. Nguyen, did my transfer. She did my second transfer. I mean, she's like the biggest cheerleader. I mean, she be pumped, okay? She be pumped. She did it. I felt good. During the 2 weeks, I was sleeping like crazy. Nauseous like crazy. Smells was getting to me, and I kept saying, this might be symptoms from my medications. I don't know, but these were symptoms that I've personally never experienced before doing IVF. So in the back of my mind, I'm like, okay, I'm pregnant. I just knew I was pregnant. We go to do the beta. It took them a long time to call, which is strange. They usually call before lunch, no later than 1:30. So in the back of my mind, I'm like, yes, I'm pregnant because I feel pregnant. I've been pregnant before. I know what being pregnant feels like. I feel pregnant. And they called me and was like, we're sorry. It didn't work. Did they call me? I don't even think they called. I think my nurse freaking emailed me. No, I'm sorry. They left a voicemail saying that it did not work. I called. They told me to stop my medications. I stopped my medication. Maybe 2 days later, I started spotting. So I said, okay, that's unusual for me, but okay, my period must be about to come since I finished the meds. So I started spotting, then the spotting stopped. Then The next day when I went to work, I said, let me put a pad on because I know my period would be coming. All while I'm questioning myself like, damn, why did we transfer 2? We should have just transferred 1. Oh, I forgot to tell you. The day after my transfer, they told me that the 4 that did fertilize, the 4 that they told me was guaranteed, they were guaranteed going in the freezer, all died. Okay? So after finding out my beta, I'm thinking, damn, maybe we should have just transferred 1. Maybe, this is our fault. I'm in that whole blaming myself mode. Then it's a Friday. It's a Friday at work. And I'm in my office, sitting at my desk, and I just felt wet. And when I say wet, I mean I felt soaked. Like somebody just threw buckets of water in my lap. And I'm like, what's going on? Keep in mind, I had a pad on. I get up to go to the bathroom. Before I could even leave the suite, my coworker said, oh my God, Regina, your jeans is completely red. So I go to the bathroom. It was blood everywhere. So I put my shawl around me. I went to Target, got me some more jeans, got me some more underpants, TMI, I'm sorry, it's a fertility video, and got me some super pads. I'm like, well, this is a little strange. I bleed heavy, but I do not bleed like this. This blood was pouring out of me as if my vagina was a faucet. It was a lot. I go back in my office thinking, okay, it's just a period. I can stay at work. Out of nowhere, the worst pain that, I'm not even going to say the worst pain, a pain similar to contractions came over my stomach area. And I'm like, what the hell is going on? And I felt something pushing out of me. This was the biggest clot I ever seen in my life. The clot was, if I balled my fist up, the blood clot was the size of my hand. I instantly called Shade Grove. They told me, oh, no, you were negative. This is normal. This happens. And I found that to be strange because I'm 36 years old. And in 36 years, let's say 20 of those years I've been going to gynecologists. They always tell you that if you ever pass a blood clot that's bigger than a quarter, it's a problem. Go to the doctor. They said, no, it's fine, it's fine. That blood clot came out of nowhere. I completely stopped bleeding. The very next day, I started bleeding again, like a faucet, out of nowhere, just random. Another clot came out, again the size of my hand. I called again. One nurse asked me my name, and I do not know the nurse name. She said, well, your number was really low, so it's unlikely that you were pregnant. Hold up. How are you telling me my numbers was low, but my nurse told me I didn't have no number, basically. My beta was 0. I'm not pregnant at all. But now you're telling me my numbers was low. So if I had a low number, how do we know I'm not miscarrying? They just kept telling me, no, you wasn't pregnant, blah, 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 blah. I've given birth a few times. I'm not ashamed, but I have had an abortion. I miscarried a few times. I know what it feels like to miscarry. And even though my doctor has told me that I wasn't pregnant, a part of me feels like I was. My nurse told me I wasn't. The nurse who answered the phone told me my beta was low. How do you go from a 0 to a low number? I don't know. So this whole time I've been blaming myself because I'm feeling like if I would have went with my gut and stayed on my medication, maybe if I did in fact miscarry, maybe I could have saved the baby or babies. And the reason I say that is because in the past, being pregnant, I never found out early. I've never found out. It's never been a 2-week pregnancy test with me. When I found out I was pregnant with my 17-year-old, the day that I found out, they told me I was 16 and a half weeks, and they told me what I was having. Please keep in mind that prior to going to the emergency room that night, I just went off my cycle. So, yeah. So after all of this, they told me, well, my doctor's like, I don't know why it didn't work. Everything looked great. It was a textbook transfer. Everything was perfect. I'm going to set you up for another HSG to make sure your right tube isn't blocked. So my nurse had one of the front desk people schedule my appointment. She scheduled my appointment, and she said, well, you have to come in. She said, I'm going to schedule you for November 17th at 12:30. You come to the Towson location. And I said, huh? Why do I have to come to Towson to do an HSG? I'm a patient of Kaiser. Any diagnostic test is done at Kaiser. So why do I have to come to Towson for this?